allegations of misuse or whatever, right? So, this is the call to order for the Tuesday, August 19th, 2025 meeting of the Finance and Government Operations Committee. Good afternoon and welcome to today's FGOC meeting, everybody. My name is Betty Young and I'm the chairperson for the committee. Will the clerk please call the roll to establish the presence of a quorum?
Vice Chairperson Ellenberg.
I am here.
Chairperson Young.
Here.
We have a quorum. Thank you.
Fantastic, thank you. We're going to now move to our first item on the agenda, which is public comment. This item is reserved for persons who wish to address the committee on any matter within the subject matter jurisdiction of the committee that is not on the agenda. Members of the public who wish to address the committee on a non-agendized item should request to speak at this time if you haven't already done so by submitting a request to speak form if you are in chambers or by using the raise hand icon if attending virtually. I'm going to turn to the clerk now to see if there are any speakers for this item.
There is one request to speak online for a total of one speaker.
All right, I will give them 3 minutes. Yep.
Parent, you will have 3 minutes to speak. The timer will start when you begin speaking.
Yes, hello, good afternoon. I wanted to see if this committee would be willing to either open investigation or start the process of removal for District Attorney Jeff Rosen. I've spoken to you guys before about this, that my kids are being sexually molested and that District Attorney Jeff Rosen knows about this, and when he found out about it, after I told him, he filed charges against me with the intent of covering up this sexual abuse, and during this process, he's allowing the person involved or the people involved to physically assault me and to cause great bodily harm to me. And it's outlandish that we allow a district attorney to behave in such a manner. He's supposed to be out there protecting the community, and what he's doing instead is he's covering up crimes. He's incentivizing these crimes, and it's just horrendous. We just heard recently about the police officer in San Jose, Saul Duran, that Jeff Rosen knew that he was having inappropriate relationships with young girls as far back as 2017, and he never even reported this to CPS. I mean, this is in the Mercury News, and this allowed this officer to continue being a foster parent and to continue being a police officer, and allowed him the opportunity to continue to sexually abuse other children. And you can also see this with Dr. Patrick Klein, that Mr. Rosen refused to prosecute him, and that allowed him to move on and sexually abuse dozens of other children. All he did was put him on the Brady list. I mean, if he had enough evidence to do that, why didn't he prosecute him? It's just terrible what's going on. And I posted a lot of this information online. If you guys want to Google DA Jeff Rosen petition sex trafficking, you'll find it in the top 5 results, what he's done to me. And I really hope that you guys will take this seriously and do something about this, because it's terrible. Thank you for your time.
And that concludes our request to speak.
Thank you, Colin. We're going to move on to the next item on the agenda, which is approval of the consent calendar and any changes that the committee wishes to make. I'll turn to Vice Chair to see if there are any comments, discussion, or changes.
I don't have any changes to recommend, but I would like to make a comment on item 13, which is the update on the behavioral health treatment bed expansion effort. I know that next week's at our next board meeting, we'll be receiving the quarterly public health crisis report to the board, and that report will include more information on our round 2 bond BCHIP applications. I will certainly save my questions for that discussion, but I would like to request updates on these applications at both the September and October FGOC meetings so that we can continue to track progress, especially in advance of the October 28th application deadline. And that would be a motion to approve the consent calendar.
Great. Second the motion, but I'm going to add a couple items. So I'm going to add items 5 and 9 to consent. Item 5 is to receive the quarterly report from the Office of the County Executive relating to the Santa Clara County Fairgrounds. Thank you for the report. It was quite fulsome. No questions, just my appreciation for the continued work there. And for item 9, which is to receive report from the Social Services Agency, Department of Aging and Adult Services relating to the Public Administrator, Guardian, Conservator Urgent Needs Fund. Thank you to Vanessa Merlano and your staff for managing this item. And I would also like to say that our PAGC staff does not get enough recognition for the hard work, the very involved work that they do every day. So I hope that for the staff in the room today, please relay my appreciation to your team. And that is it for my changes.
They're both fine with me.
Great. Motion is seconded, made, second.
We have no request to speak in the room and no request to speak on Zoom. I will call the roll. Vice Chairperson Ellenberg
Yes.
and Chairperson Young.
Yes.
Motion carries. Thank you.
Thank you. Moving on with our agenda is item 4, receive report relating to the fiscal year 2025-2026 annual work plans and budgets for the Santa Clara County Hsinchu Taiwan Sister City County Commission and County of Santa Clara Ukraine Citizen Diplomacy Commission to be presented and forwarded to the Board of Supervisors for approval. Do we have any presentations on?
We do have the 2 commissioners online on Zoom. They should have permission to speak. Commissioner Pandy, are you there?
Yes.
And Commissioner Madison.
Yes.
Thank you. We hear you.
On the Hsinchu Taiwan Commission, so we have 2 items in the work plan. The first item is sending a delegation to Hsinchu County, and the second item is doing a fundraising. From the Treasury point of view, we have 13,000 allocated as budget for sending the delegation, and as part of fundraising, another expense of 3,000. So for the total of 16,000 expenses, we also plan to do a fundraising, which is of equivalent amount, 16,000, to cover the 2 expenses. And currently in our budget, we have 30,000 in the commission account, and we plan to keep the same at the end of the year. If you have any questions on the budget or the work plan.
Okay.
Oh, thank you. So thank you for that presentation, and I just want to offer our appreciation for the commission's work. Look forward to seeing more, learning more about the fundraising plan and also the proposed delegation visit. I know that when it comes before the board, there will be more information about participants, itinerary, and cost controls. So looking forward to receiving that report at the board level. I know there was some details that are still being firmed out and that wasn't ready in time for today's presentation. So thank you for that report. And Clerk, this is two reports under one item, so will we hear both commission reports first before making a motion to receive the item?
Yes, Commissioner Madison is also here, and your mic is open for comments.
Thank you. I'm Nancy Madison. I'm the chair of the Ukraine Citizen Diplomacy Commission. Our main focus over the next year will be establishing an official sister county relationship with region in Ukraine. We're working with the Ukraine consulate in San Francisco. They have designated Kharkiv as being the best target for us. And so we're working with the consulate right now to make progress in that area. The other thing that we will be doing in this fiscal year is hopefully continuing to work with Open World. Open World came out with an RFP for 2026 delegations. They are on a calendar year rather than the July 1st to June 30th year the county is on. The RFP came out in July, and the proposals were due in August 12th to be exact. So we submitted 3 proposals for 3 potential delegations, Open World delegations. The first one would be in April, and the theme, is Veterans Affairs. And then we also submitted proposals for 2 delegations in September. One is Members of Parliament delegation, and the other is a Sister Cities delegation. We have told them that we're only interested in 1 delegation over the next calendar year. We will hear in November which of those delegations they would like us to do. So that is the primary focus of our efforts over the next fiscal year.
I'll turn to my vice chair for any questions.
I have no questions. I'd like to thank both commissioners for their reports.
Great. No questions here. Thank you to both commissioners as well for your work. And on behalf of the residents of our county, and honestly, receiving these status updates is one of the highlights of my FGOC agenda. So thank you so much for your work.
Thank you.
Great.
And we have no requests to speak online and no requests to speak in the room.
I'm happy to, we're not approving the work plans, right? Just receiving reports?
No, these are just receiving the report. Oh, and forwarding to the board.
I'm
Yes.
happy to move receipt of the reports and direction to forward them to the full board.
Second.
All right, Vice Chairperson Ellenberg.
Yes.
Chairperson Yoon.
Yes.
Motion carries. Thank you.
Thank you. Item 5 was added to consent, and we are at item 6, which is receive report from the Office of Emergency Management relating to planning, preparation, and impact mitigation for calendar year 2026 Super Bowl and Federation Football, FIFA, events regarding human trafficking.
Get this thing to work. There we go. Well, good afternoon, Chair, Vice Chair. Thank you for having me here today to provide a verbal report ahead of the September presentation that will be coming back before FGOC. So I'll give you a quick overview, and certainly can try to answer any questions you may have today. And certainly when we come back in September, it'll be a much larger group and a presentation. So Dana Reed, Office of Emergency Management, by the way. Thank you again for having me here today. Well, as the board would expect, and certainly the CEO would expect, we engaged very early on in the planning process. We actually started a couple of months ago meeting with the Federal Coordinating Officer from the Department of Homeland Security, TSA, the FBI. So we started out on the federal level because those were some of the first meetings that were had. We attended that. City of Santa Clara also attended those meetings. So this started back a few months ago, and now it's building. There are actually 31 subcommittees doing planning. So it's a huge endeavor. And it's organized based on the incident command structure. So if you looked at it, it looked just like an org chart. It's got somebody at the top, and then it's got 4 divisions, and then it's got all the subsets underneath. So it's a huge endeavor. And we've been involved in that, like I said, for a couple of months now. While the county itself is not hosting the event specifically, the City of Santa Clara, of course, has all the games. They have the Super Bowl in February. They've got the 6 games for the World Cup, June, and then the final game in July 1st specifically. we have to support those organizations and be ready to support them if they need help or they need additional resources. I think more importantly for the county and the way the county's always responded to, and this was particularly a great example would have been during Super Bowl 50, 10 years ago, we also stand ready, what if we have something else happen in the county on that day or that week? So that is really what OEM's role is to be ready, prepared, and to support anybody that may need assistance. We're going to be activated for 10 days for Super Bowl in the EOC. And for FIFA, we're going to be activated for 21 days. So it's quite an endeavor. We'll staff our EOC with all the right folks. The mutual aid coordinators for fire, law, and EMS have already been meeting and talking, as they will actually be the conduit for any additional resources, ordering of resources, the movement and deployment of any emergency response resources. We're also bringing to the table the health and hospital system, as you can imagine. God forbid if we have any type of a significant event, we're going to be counting on the hospitals. Now, more specifically, we've identified some of our hospitals as what we call critical infrastructure. Obviously, we've designated our 2 trauma centers, and we've designated Stanford as well, and we've designated county communications, and we've also designated Sheriff's Building in our EOC because that's where we're at, serving both on a local, county, and regional and state perspective. So those are already in place. We're going to get, HHS is going to be involved with the process. There's a subcommittee that is working on that. EMS is already engaged. Law enforcement, the Sheriff's Department's already engaged as well. So it's a big, big lift with a lot of planning, a lot of questions, and a lot of things to prepare for. So we have public health that will be at the table, behavioral health, all the major county departments that will be ultimately involved as time goes on. Right now, what we're doing is we hold monthly meetings with all the partners. This is a meeting that is not public. It's only with the partners, law enforcement, the appropriate agencies, federal, state, county, and local. We are in coordination with the City of San Jose. They're going to be doing a large amount of the hoteling for the games, and certainly we'll probably have some specific events associated with Super Bowl and FIFA. City of Santa Clara, of course, will have events. There will be a practice field in Palo Alto at Stanford. There will be a practice field in San Jose at San Jose State. So we know some things so far. We don't have the exact schedule. Of course, we don't know who's going to the Super Bowl, but there are a lot of predictions on that. I'm not making one. And then we don't know yet about FIFA because they won't release the schedule or what countries will be playing until December. But we know the games are going to take place, but we don't know what time. So as this continues to move along, more information will come up, more information will come out. But we are definitely connected with all the right entities. We keep the CEO informed regularly. We're happy to keep the board informed. We've already done 2 presentations at the EOAC that Supervisor Lee sits on. And we also have a meeting that we meet with all our emergency managers in the county. We've kept them informed, and certainly happy to come back to FGOC to provide updates as well. Another topic I know that is important to the county, rightfully so, is the topic of human trafficking and violence against women, or gender violence as well. That has a subcommittee as well under this structure. The district attorney's office and the sheriff's department are involved with that as a part of the planning process. OEM doesn't have a direct role in it, but certainly we have an interest in it and a part of the coordination effort. So primarily, we're getting ready to activate the EOCs, making sure we have as much information as possible. There are some other pieces I can give you today very quickly. There will be a regional coordination center that City of San Jose is hosting, and that is being run by the FBI. And then there's also the EOC in City of Santa Clara and their operations center. They'll be activated just like us. We will have a OEM rep embedded there, and we also will have a OEM rep embedded in the RCC. So this way we can have quick communications and updates and intelligence as needed. And then, of course, we're doing exercises, right? So that's an important thing to do for us to prep, and I think there's about 4 exercises planned between now and FIFA. So lots of things in motion. We're keeping a close watch on everything. And I'm here if you have any direct questions that I can try to answer, but really look forward to coming back to see you in September, quite honestly. Thank you.
Thank you. Vice Chair?
Dana, thank you for the report. It's always nice to see you. Could you just go back to the hospitals that are being activated? Could you say again which three?
So the three primaries, from a standpoint of trauma care and the fact that they have air transport capability, will be, of course, Valley Med, and of course, regional, and then Stanford. Now, interestingly enough, St. Louis has air capability as well, so that's an option as well if you had to airlift. And then, of course, Good Samaritan also has a helipad as well. So there are a couple of other options if you need that type of asset, but the three primaries are the ones that I just mentioned.
Got it. Thank you.
You're welcome.
James, of course, I'm looking at everything right now through the lens of HR1 impacts. I'm sure you're thinking about this as well. Both of these events are well enough into the future that we should really be deeply feeling a lot of those cuts. Is there some way in which your office is particularly keeping an eye on the response, the costs associated with the response? I know there's some reimbursement from the state, but not as much as we need. Can you say more about that?
Sure. So the state has made an initial allocation of, I think it's about 10 million total between Los Angeles and the Bay Area to cover costs associated with these events. That's, of course, hardly a drop in the bucket compared to the costs that public agencies will collectively incur associated with security, staffing, emergency operations center, as Dana mentioned, overtime, specialized support units, et cetera, for the different cities.
Best case, assuming there is not some catastrophic
Absolutely.
accident
This
or
is all just
casualty.
baseline
Right.
staffing needs. We believe that there will be additional state funding, probably also still woefully insufficient, and that there may also be some federal funding that's allocated as well. We don't know the details of how the federal funding will be distributed or earmarked, but our understanding is that there will be some significant federal funding, given that this is a national level event that involves national security resources that are committed to these events. So that all remains to be sorted out. The couple things that I can share specifically around that, one is were requested to be the administrative fiscal agent for the allocated state funding. That's, of course, a significant administrative burden, but the good news about that is we are able to recover those costs associated with it, but it also means that, and is one of the specific conditions under which we had agreed to take on that extra responsibility, that county projects would be in the mix. What happened in Super Bowl 50 is we were left out of any reimbursement at all. So it's not going to cover our full costs of all of these different pieces of things, but I can say with some confidence that the county will at least obtain some cost reimbursement for some of these activities.
So there's a Super Bowl every year. Is there not sort of a standard package that comes along to whatever city is hosting or region is hosting the game that year?
No, there's I suppose more of a standard package of federal resources that get deployed to these high-profile national security events. Super Bowl is one of them. And so that will come, that will bring with it a whole number of federal-related, mostly law enforcement-associated assets, so materials, resources, and staffing. But there isn't a package of reimbursement for locally incurred costs. And of course, there's significant ones, and it's not just the county organization. We have ours in terms of the EOC, Sheriff's Office, et cetera. But tremendous amounts of overtime and other costs for police departments, fire departments. Our EMS system is going to have many, many more ambulances staffed. There'll be a lot of overtime related to that. these are all significant increased costs. One of the things that is often misunderstood around these events is, well, people say, don't you recover these from the increased economic activities, right? Or don't you recover these from the ticket sales? And the problem, of course, with that is threefold. One, there often isn't a direct relationship between the economic activities associated with the events and any actual tax revenues. But second, to the extent that there is, those are not revenues the county receives. So, for example, if there's increased utilization of hotels, there may be TOT taxes. The county doesn't get those. To the extent that there's increased sales tax revenue, the county today only has a 1/8 of a cent sales tax that comes to the county. The state and cities and VTA, for example, have significant shares, but the county doesn't. So there really is no meaningful revenue to the county. To the extent that there's a fee associated with the tickets, that'll go to the city of Santa Clara as the entity that where the stadium is situated and the entity that has joint ownership over the operation of the stadium with the 49ers. So none of these items that are in discussion actually provide any revenue source to the county government. And of course, we have legal responsibilities for the coordination of all of those resources. As Dana said, we're going to be staffed up. I actually had the opportunity to work with Dana back during Super Bowl 50. I was a deputy county executive at the time, and I was in that EOC the entire week during Super Bowl 50. And it was full. We were fully staffed. There's a real cost associated with that, right? Pulling all of those other county staff and partners there for all the coordination, all the monitoring, because it's not just the event itself. There's the after parties, there's the before parties, there's the NFL experience, et cetera, all of which bring associated logistics, coordination, security risks, medical needs, and so forth. So it's a whole set of activities. Same thing's true for World Cup, which of course is a whole series of events, not just one event. So there's real costs, and there's not a direct relationship between any revenues or economic activity and offsets. And that's just not well understood, but it's something that impacts us particularly acutely as a county. So we have made that case in conversations with the state. There's a modest recognition of that in our role as the fiscal agent, but it's not going to fully offset those costs, and that's a reality we have to face.
Thank you for walking me through that. I don't have any other questions.
Thank you, Dana, for the report. And more importantly, thank you just for meeting this moment, mobilizing your staff, being at the ready to make sure that the millions of people who will be descending upon the Bay Area are going to be safe. James, this may be an unfair question, but you seem to know a lot about everything. I'm happy to also, I think this is a question that's really more directed towards the organizers and conveners of the games, right? But it just begs the question, when the Bay Area Host Committee, when organizers put in a bid for these type of mega sports events or mega events in their city or county, or in their neck of the woods, I'm assuming that these applications, these proposals require to understand the emergency system, that there are hospitals that are at the ready. Is that part of the application at all?
So I'll share a couple things on that, and Dana, if you want to add anything, please feel free. So one is there is no coordination required with the other entities involved. So just to be very concrete about that, the county didn't have an opportunity to review or comment on any of those plans, the funding that would be needed for those plans, the resources and assets that would be needed. And likewise, in fairness to them, neither did VTA or the other cities in the area, et cetera. So we were not part of any of that proposal process. I do believe that when looking at these kinds of events, whether it's the Super Bowl or World Cup or the Olympics or whatever else, because that's the other, of course, big thing that's happening down in Los Angeles that's part of these broader conversations at the state level. They, of course, do look at what infrastructure is more broadly available in terms of transportation, arteries, and infrastructure. They definitely look at making sure that there's access to healthcare and other resources. And the point that I would make there is, this is just another example of why the fact that we have the public healthcare resources we have here contributes to the viability economically of the region as a whole. You know, Dana mentioned those hospitals. And this isn't true, I think, of any other major city in the United States. The only trauma centers in the city of San Jose, one of the largest cities in the United States, the only trauma centers are county hospitals. Just think about that. And you can't be hosting these kinds of events and incidents without having that kind of capacity and resource. So, you know, that's where there's the intersection, right, of all these things. You can't have these events if you're in a community that has no freeways. You can't have these events if you're in a place that has no airports, right? But you certainly can't have these events if you're in a community that doesn't have level 1 trauma services. And that's true for all of these categories of events. Anytime the President of the United States comes and visits, there's always a designated trauma hospital on standby, right? Wherever the president goes, whoever the president is. You know, these are the kinds of core infrastructure that you have to have in place. So here in San Jose, that is the county through its healthcare organization. Here in the South Bay region, that's the Office of Emergency Management for the purposes of coordination across the jurisdictions, because we have, interestingly, the city of Santa Clara, not actually the bigger city of San Jose, being the actual location of the games. But as a much smaller city, there's, of course, then a dependency on a broader ecosystem and the coordination across jurisdictions for mutual aid if there's an emergency, for logistics, for that planning, falls on the county as the operational area coordinator. So that these things all fit together in that way, and you know, it's not something that, it's something that on a day-to-day basis, if you are a city of Santa Clara or you are the 49ers and you have a stadium and you want to host these kinds of things, you take all that other broader infrastructure for granted, but people really shouldn't.
No, they shouldn't. Thank you for that context, James. I can't imagine any entity assigning a massive mega event to a city or county that doesn't have the necessary infrastructure in place to support its actual baseline operations, and let alone like being able to respond to emergency surges. So, James, we are facing down a crazy fiscal cliff in budgetary restrictions. Hypothetically, I don't know, because I hope this stays in the hypothetical, as we continue to understand the impacts of HR 1 on our health system, and as we look towards the future in terms of making sure we have a health system to serve our residents of Santa Clara County, like, I mean, at some point, do we tell the host committee that we don't have the capacity that they need for these type of mega games just because of where we are at this point in time?
You know, I think we do need to have real conversations that involve the state around how these kinds of things are resourced and coordinated. And it's, I know that there's some significant conversations happening, in particular in the Los Angeles area, in the wake of the devastating fires right there, and the fact that not only do they have World Cup related events coming up, but in 2028 they're scheduled to host the Olympics, and what resources are needed for that too. But I think it really demonstrates the dearth of more comprehensive planning and inclusion of other affected entities in those conversations. in my view, that's something that really needs coordination from the state level in order to be effective. So I know we have certainly articulated very clearly to Cal OES, for example, that the role that we have to play here and the challenges that are faced with the current structure around it. We'll see what happens, like I said, with some of this federal money that might be flowing. But it does, I think, in my view anyway, my professional judgment is it's actually a role that the state has to step in because it's not reasonable to think that just whatever the particular host city might be, that they're going to necessarily see all those dots to connect them per se. But the state, I think, has a very important role there.
Thank you, James. Dana, I have no more questions for you. Just my deepest appreciation and anticipation, excitement for the full report that's going to be coming towards to FGOC. Thank you for your work, and please thank your team for me.
Thank you, Chair, Vice Chair. Thanks for having me again today. We'll see you in September.
Yep.
Look forward to it.
All right.
All right. Thank you.
Thank you, Dana. Colin, do we have any public comment on this item?
There are no requests to speak in the room, and there are no requests to speak in Zoom.
Okay. Looking for a motion to receive report.
So moved.
Fantastic. Second.
Vice Chairperson Ellenberg.
Yes.
Chairperson Moon.
Yes.
Motion carries. Thank you.
Awesome. Thank you. Up next is item 7, which is to receive report from the Office of the District Attorney relating to implementation of recommendations from the management audit of the Attorney and Administrative Support Cost Centers of the Office of the District Attorney.
Good afternoon. Good afternoon. We provided because of Supervisor Ellenberg's good suggestion to have a matrix, in other words, to go through all of the audit recommendations and condense it to, here's a summary of the recommendation, here's whether we agree or partially agree with it, and then here's where we are in terms of implementing if there's something to change. So that was a helpful suggestion, and we think we've provided that, and we're happy to answer whatever questions you or Supervisor Ellenberg has. Excuse me.
I'll turn to my vice chair for questions, concerns, or comments.
No questions. I appreciated the presentation. It was very clear, and the progress is self-evident. Thank you.
Yeah, thank you. Let's see. I do have a couple of questions. For item 8.2 for the community prosecution functions, just really asking when will this work come to the board?
Sure. I'm joined by Stacy Capps, one of the assistant district attorneys in our office, and Peter Jensen, our administrative services manager, and I think Stacy can take this question.
Yeah, and this comes from a place, just to clarify, as being a big fan of the community prosecution
Thank you.
work.
Thank you. So our community prosecution unit has been consistently, since the audit, been using surveys on crime prevention and truancy abatement. And we believe that the surveys are a testament to how well the services are being utilized. And in addition to that, we have done some research into how many calls for service we are getting both before an abatement of a nuisance and after an abatement of a nuisance to see how successfully we are responding to those nuisances. In addition, we have been and have completed several surveys as to the South County Youth Task Force, as well as, I'm sorry, I'm just drawing a blank on the other name, the Parent Project. Yes, thank you. So both the Parent Project and the South County Youth Task Force, we've done a number of surveys on those and have the results from those surveys, which have been very positive.
Thank you. Thank you for that update. And then for recommendation 8.1,
Yes.
Just really, I mean, this may be a premature question, but once that work is complete, how do you, and we see the data, how do you envision it'll be used to adjust practices?
Sure. 8.1 and 8.2 were two different units within the office. 8.1 was dealing with our camp unit. And currently, we've just started working with the computational policy lab out of Berkeley to run a statistical valid recidivism study on both men and women who are on different diversion paths. We've just started working with them, so we don't have those results yet. And then as far as the surveys and different metrics that we're using in our community prosecution unit, we haven't completed a report on that. I think it's something that's in the works, and we'd be happy to present on that when we're completed.
Okay, thank you. Thank you for that. I think those were my only questions about this, and I took the questions for 8.1 and 8.2 out of order. I should have done 8.1 first. But yeah, also strong interest in understanding how the data metrics there that has been recommended will be used in the future, if you, what you envision there. And, you know, I know that from your response now, it's very preliminary still, so I'll hold that conversation for future discussions.
Thank you.
Yeah. I think that's it for my questions.
I'm happy to make a motion to receive the report.
Yeah, second?
And we do have one request to speak in Zoom.
Oh, I keep on skipping over this. Great. Sorry about that, and thank you for the notice, Colin. So one speaker, I will allot 2 minutes for the speaker.
All right, parent, you will have 2 minutes to speak. The timer will start when you begin speaking.
Yes, I mean, if you look at the matrix, I'd like to touch on 3.1, which is a standard for charges. In one column it says no agreement, and the third column it says not implemented. And, you know, I think this is really important that we have a standard, you know, across all cases for when you're going to file charges. Like you have criteria A, B, C, you've met the criteria, you go ahead and you file charges. And that should be your motivation for filing charges. And your motivation shouldn't be, you know, that somebody asked you, a friend asked you, hey, you know, there's a crime that I've committed, you know, can you file charges against this person because I need to cover up the crime? I mean, that shouldn't be the standard. And unfortunately it is. And I think that by not agreeing to this recommendation, that this attorney is basically saying, hey, I can do whatever I want, and there's nothing you could do about it. And, you know, the second thing that you really need to do is, like, if during this prosecution, it comes up that the defendant is being assaulted because this third party wants the defendant to take certain actions in the case, I mean, you don't let the prosecution continue. And that should be in that 3.1 as well. No assaults during a prosecution. But unfortunately, this district attorney, he doesn't care. I've suffered severe injuries because of him. And we should accept 3.1, maybe compel him to agree to it. And thank you for your time.
And that concludes our request to speak.
Thank you, Colin. So we have a motion and a second, and we'll go to vote.
Vice Chairperson Ellenberg
Yes.
and Chairperson Young.
Yes.
Motion carries. Thank you.
Thank you.
Thank you.
Thank you.
We now move on to item 8, which is receive report from the Roads and Airports Department relating to implementation of recommendations in the management audit of the Roads and Signals Operations Division, Roads and Airports Department. Hi, Harry.
Good afternoon. Hi, Harry Freitas, Director of Roads and Airports. We're pleased to present our progress on the board's audit of our Signal and Operations Division. I'm joined here by Anath Prasad, who manages that division. He's our Deputy Director. We've prepared a staff report, and we have slides at your pleasure. We can do either or answer questions.
Do you have any questions? Oh, I would love a presentation.
Oh, okay, we have a few slides.
Yeah.
Let us just log in, or we're just need to do a little
While they're
technology.
pulling up their slides, I'm just going to share that I had the opportunity to go and visit the Traffic Operations Center for the first time just a few weeks ago. And if you haven't been there, it's really impressive. I was just blown away by all the work that they do and the systems that they have in place. Makes me very proud of our roads department. I mean, I already was, but even prouder of the incredible work of the roads department. So thank you publicly. I thank you separately already, and also to your entire teams.
I just want to say thank you very much for coming out. We very much appreciated it, and it's our pleasure actually to host people and learn more, teach people about our services. I will add, just in the spirit of what James is talking about, is our department has a quarterly leadership meeting, about 30 people. And next month, we will be visiting VMC at the invitation of Paul Lorentz. We'll do our quarterly meeting in the auditorium, and then our staff will do a tour of VMC. This will help us better understand, part of the county that most of us really, we don't certainly work with that part of the county very often. We may need that part of the county in our personal lives, but it's a really good cross-training opportunity to really understand better the mission of the county. So we're really looking forward to that, and so thank you very much.
I think I'm the only person on the dais who has not seen it, so yeah, I'm still going through my rounds of visits, site visits as the new supervisor tour. But yeah, I think
Well,
I'm
you'll
gonna
be
have,
ahead of me. It took me 15 years to get there, so.
I'm gonna have to move up the list because everyone keeps on telling me how cool it is. Do we get to push any buttons while we're there?
Yeah, they've got lots of great stuff to show you.
The important issues. Okay, go ahead, please.
Yeah, thank you. Anand Prasad, Deputy Director, Roads and Airports Department. I have a short slide presentation. The background, the road and signal operations management division had a management audit back in September 2022. It was a 2-year audit. It was concluded in 2024, September. And they actually came out to the FGOC to make a presentation on the full report. And then back in 2025, April 2025, we provided a 6-month update to this committee. And now we are back again with the August update, which is probably the 9-month update. Basically, in summary, here are the recommendations, audit recommendations. They had 8 sections and 27 recommendations. Out of the 27, 21 of them were directed to Roads and Airports Department, 2 of them to ESA, 2 of them to Office of Communications and Public Affairs, 2 are directed to Board of Supervisors. And then I'm going to move on to the 21 recommendations that were for the Roads and Airports Department. So we have completed 15 of those recommendations as of today. And then we have 6 more pending. We're working on that, and we hope to complete them by end of this calendar year. So that concludes my report, and we have a full report, the matrix attached. If you have any further questions, we'll be happy to answer anything.
Turn to the committee, Vice Chair. Do you have any questions or comments or concerns?
I don't, but thank you so much for the report, and to both of you for your ongoing enthusiasm for the work that you do. I have also not done a field trip yet, so that will certainly happen in the near future. Thank you.
Okay.
You're most welcome. Thank you.
Thank you. No questions from me either. My office has received confirmation that the 6 recommendations still in progress are in good progress, and there's not any extenuating circumstances that will delay its completion. Great. Thank you so much for your work. And then we're going to turn to public comment to see if there are any questions or comments from the public.
There are no requests to speak.
Great. So seeking a motion to receive report.
So moved.
Second?
Vice Chairperson Ellenberg
Yes.
and Chairperson Young.
Yes.
Motion carries. Thank you.
See you soon.
Thank you.
Item 9 was received up on consent. Item 10 is very much related to item 9, but it does have an action attached to this that requires movement from the committee. So item 10 is consider recommendations relating to the public administrator, guardian, and conservator deferred fees and uncollected fees. And Vanessa, thank you for being here. If there's any highlights from item 9 that you want to incorporate here to help provide context, please feel free to do so.
We're on? Okay. Good afternoon, Chair Jung, Vice Chair Ellenberg. My name is Vanessa Merlano. I'm the Director of the Department of Aging and Adult Services. I'm going to ask my colleague to go ahead and unmute so she can introduce herself.
Okay, it did work. Good afternoon. I'm Lisa Pate. I'm the Chief Deputy Public Administrator, Guardian Conservator.
And Lisa has long tenure with PAGC, which we'd like to offer that acronym for you all. So we'll go ahead and let Lisa provide some subject matter expertise on the item.
So as far as item 9, Urgent Needs Fund, we are happy to report that that is a fund that is recouped through clients' funds. And for the last 5 years, it has been 100% recouped. So the $100,000 that the county puts in is paid back through clients, and we have done it 100%. So that is very good news. So we're glad that that went on consent, because it's going great. As far as our uncollected fees, so the public guardian collects fees from those that can pay fees. So a lot of the fees are deferred, and we do have to wait for court accountings to approve fees. So that's what you see in this chart that's on the file. I don't know if you have specific questions about the uncollected fees or collected fees.
Vice Chair?
I just wanted to offer one point here. And we just want to recognize that these unrealized fees are really with folks that cannot afford to pay for these fees. And so when there's an opportunity for us to collect on those fees, there's absolutely action taken to collect on those fees. But these really are folks that without the PAGC, they would be left destitute.
Thank you. I'll turn to Vice Chair.
Thank you for the report. I don't have any questions. I appreciate the distinction between who is charged a fee and the way you budget in order to not show losses. And thank you. Just a general question about your office. Are you seeing any kind of significant increase in guardianships or petitions for public administration?
Interestingly, no.
That is
Slight,
interesting.
Slight, very, very
Okay.
slight. So in the mental health LPS world, it's slight, and I mean 10% increase. We will see what happens with SB 43 in January when they expand grave disability. Probate, we have seen also a slight increase, and it's not due to capacity issues as much as undue influence and financial abuse has increased tremendously.
Wow. That's obviously concerning, and I imagine as more of our population ages, and that really becomes the biggest demographic, that unfortunately we will see more of that. But it's, I will be very interested to hear what happens. I know it's not on today's agenda, but once SB 43 really is in full swing, what that looks like for your office.
Absolutely.
So thank you so much for the report.
You're welcome.
Thank you for the report. My only question is really just your observation about trends, like specifically with the uncollected fees, where it stands historically, where we are today. Is this an increase or a decrease, or is there any deviation from the norm with what you see today or recent years?
So uncollected fees is actually decreased. We're collecting more fees. We also increased our fees in January of this year. We increased our investigation fees, our monthly fees, and our trust fees. However, the same folks that couldn't afford it before still can't afford it now. But for the ones who can, we are collecting more fees because they got raised.
And we're not seeing an increase in the number of folks that we're engaging that are not able to afford the fees. It sounds like it's been baseline, like,
Yes, it's baseline. The majority, the clients that we serve most are LPS, which are severely mentally ill, and those folks are usually deferred for their fees.
okay. I guess like a broader question is like, do we know if the courts are conserving more unhoused individuals? Is that another entry point into our system?
So unhoused in general is not a reason for grave disability. So what we've seen the judges actually say to unhoused folks, not all, but it has happened, they can go to court, they can request a hearing and say, I can provide for food, clothing, and shelter. And the judge says, you're unhoused, and they say, I've been unhoused 25 years and I'm still able to provide for myself, and that is my shelter. And the case is dismissed and they are not considered gravely disabled. We do get unhoused LPS clients, but it's a small number.
Thank you. That's very edifying. I appreciate your work. Like I said in the comments during the consent calendar, is that I don't think your office gets the due credit it deserves for the hard and very in-depth work you do every day.
We agree.
Yeah. So
Thank you.
we have an action here. So the possible action is to receive report from the Social Services Agency and to forward a recommendation to the Board of Supervisors regarding the annual write-off of the PAGC uncollected fees in the amount of $157,421.74.
I'm happy to move the recommended motion.
Happy to second the recommended motion. Are there any public comments on this item?
There are no requests to speak. Vice Chairperson Ellenberg.
Yes.
Chairperson Young.
Yes.
Motion carries.
Thank you. I see staff making their way up. So up next is item 11, which is to receive the monthly state legislative report from the Office of Intergovernmental Relations. Because nothing's happening there, right? Very. Thank you.
Good afternoon.
Hi, David. We could hear you.
Madam Chair, Madam Vice Chair, David Campos. I'm here in the Sacramento office. As you know, the state legislature is back, but I wanted to just make sure that Elaine Trin, who's in the audience, who's at the board chambers, if she could identify herself as well.
Thanks, David. Good afternoon, Elaine Trin, Program Manager with IGR.
And if I may begin, Madam Chair, we have in the audience Emma Sheeb, who is our newest member of the Intergovernmental Relations team. And I think a couple of you have been able to meet with her. But I wanted to just begin by noting, as you know, the role of IGR is in close consultation with the board and through the policies and procedures laid out by the Board of Supervisors, advocate for and represent the interests of Santa Clara County and Washington, D.C. and in Sacramento. As I noted at the beginning, the California legislature is back from recess. And Madam Chair, as you noted, there's a lot of activity, as you suggested, there's a lot of activity right now. And that's why I'm here in Sacramento, because there are a number of things that are happening this week as the legislature is coming back from its recess. The first thing is that there is a number of actions that have to be taken to finalize the budget, but probably the more public and the more immediate thing has to do with a legislative package that has been introduced that would redraw the state's congressional districts, and that is in response to actions taken by the state of New York. That package of legislation around redistricting will be finalized. It has to be legally finalized by Friday of this week. And today, that package was heard in committee in both the Assembly and Senate elections committees, and there will be a hearing to allocate funding for that effort tomorrow in the Appropriations Committee. We expect that a floor vote on that package will happen in both the Senate and the Assembly by Thursday of this week. And so, that is probably the top priority for the legislature between now and Friday. And as you know, that will impact the action taken by our Board of Supervisors that put a sales tax measure on the ballot. So we won't be just having a local special election, there will be a statewide special election, and our hope is that at least that will help pay for some of the costs that we will incur with our own special election. I also want to note that there are a number of hearings that are happening at the state legislature. In fact, one of those is happening today. There is an informational hearing that's a joint hearing between the Assembly and Senate Health Committees, and the focus of that hearing is on the impacts that federal action has taken on access to healthcare because of the immigration enforcement. So the interaction between immigration enforcement and access to our healthcare. And so that's the subject that's being discussed right now, and we're actually testifying, providing testimony during that hearing. And after this meeting, I will be going back to see the remainder of that conversation. Tomorrow, the Assembly Budget Subcommittee on Accountability and Oversight will be having a hearing on the federal cuts embedded in H.R. 1 and the impacts of those cuts on the state's budget. So as you know, the deadline to sort of finalize the bills that remain is very tight. They have until August 29 to finalize some bills that remain. And with that, I do want to give you a brief update on the 3 bills that we submitted during this existing legislative session. Assembly Bill AB 1025 by Assemblymember Gail Pellerin, which is the standby Guardian bill that was actually held by the Assembly Committee on Appropriations. And right now we're in conversations with Assemblymember Pellerin about the possibility of bringing it back and strategies to make sure that it's successful in the next session. We also have SB 261 by Senator Wahab that aims to encourage businesses to satisfy their outstanding wage theft judgments. That will be heard by the Assembly Appropriations Committee tomorrow, August 20th, and we note that Chair Jung actually testified in Sacramento a couple of times on that bill, so we're cautiously optimistic that that's moving forward and that it will see the finish line. Likewise, we have AB 243 by Assemblymember Patrick Ahrens, which aims to increase access to affordable higher education for youth that our system involved, and that is currently on the Senate floor. The last thing that I would say is that, as you know, the governor and the legislature passed a budget on June 13th, and that reflected a series of agreements that were made, and there were a number of trailer bills that reflected those agreements in June. But the big issue with respect to the budget is the fact that H.R. 1 had not been passed by the time the budget was finalized, and therefore what remains is the really heavy lift of making sure that the state budget reflects the very significant changes of H.R. 1. And while it's not clear what the details will be, it is acknowledged that the legislature will need to take additional actions with respect to the budget to account for the impacts of H.R. 1. And of course, we are very attentive, watching that very closely, because that clearly will have some significant impacts on our own financial well-being. So with that, I will turn it over to Elaine to continue talking about some of the additional work, and at the end of the presentation, happy to take questions. Elaine?
Thanks, David. So as you just heard, the legislative session is still underway, but IGR has spent the summer in the process of updating our legislative platform for the upcoming session. As a quick reminder, our legislative platform is made of 4 components. It's our policies document, our priorities, initiatives, and funding requests. So as part of our annual process, we update each component in close collaboration with departments. Before you is a timeline of our process on how we're updating our platform. And so this process kicked off in June. And then we spent a majority of July and August meeting with departments, board offices, and held virtual drop-in office hours. We hold these meetings really to hear from departments and what they're thinking about in terms of edits to the legislative policies document, any proposed bill ideas that they're thinking about, and to really hear from them about issues of importance that are on the horizon. Just to keep IGR informed as we enter into the next session. And so legislative policy edits and legislative bill ideas are due to IGR this Friday, so we're expecting to get those from departments. And so once we get those, IGR and the County Council's Legislative Affairs team will go through the edits and vet the bill ideas. And we will bring the legislative policy edits to the relevant board policy committees in October, and then package everything and bring them to the full board for approval in November, and spend December and January securing authors for the approved bill ideas. And with that, we're happy to answer any questions.
Thank you, Elaine. Thank you, David, for the presentation. I'll turn to Vice Chair to see if there are any questions or comments.
Thank you. I want first to lift up some of the good work of CSAC. Recently, we really launched a full court press at the governor to ensure that counties are paid upfront for the costs of the special election. There's no reason that individual counties across the state should incur those costs. And it looks like that is going, thank you for nodding, Elaine, that is going to be a piece of this special ballot measure. In addition, of course, to the concerns about H.R. 1, we have concerns about Medi-Cal, about the Cal-AIM renewal, about the fact that H.R. 1 rendered Prop 35 moot, which was a significant funding source for public hospitals. I'm interested to know whether Santa Clara County is kind of going this work alone around the Medicaid impacts in particular to counties, or are we part of a coalition of other counties that also have public hospitals?
I can respond to that. So we're part of the California Association of Public Hospitals, which represents all of the public hospital systems in the state of California, and does significant advocacy related to funding associated with public hospital systems, particularly Medi-Cal-related funding. And I know that CAPH is very actively participating, and we are absolutely working in partnership with others. The single largest other county system is, of course, Los Angeles County. They have come out with some forecasts that are very much aligned with ours on anticipated fiscal impacts. And LA has long been a strong partner. We have been partnering even before H.R. 1. So some of this, I'm realizing that most of the health system specific updates are shared at HHC, where there's a standing item related to Medi-Cal specific legislative associated updates. But for example, Paul Lorenz and I joined a presentation supported by our IGR teams, a presentation with Alameda County and Los Angeles County Health Systems to a number of legislators back in, I think I have the months right, it all blurs together, but I think that was back in May. And we've had a number of other very significant engagements. So yes, we're working in partnership with others who are affected. That being said, the magnitude of impacts are particularly acute here in Santa Clara County. for a variety of reasons, but really a reflection of the fact that we have done such good work in this community to reduce the number of uninsured and to take advantage of leveraging federal dollars. And so, that leaves us particularly at risk with H.R. 1, but is in part a direct result of what's a really incredible and undertold success story of bringing an incredible amount of federal resources in. So it is in partnership. It's in partnership with a lot of folks, but there are some unique impacts to Santa Clara County as well.
Thank you, James. And as our system gets much more attention over the next several months than it has historically, I wonder if you could speak to a question that comes up in the communities, that while we acknowledge that all county governments, not just Santa Clara, are responsible for health care of the indigent, only 13 of the 58 counties have their own public hospitals.
Yes, that's exactly right. And over the decades, many counties have closed public hospitals. And what you see in some parts of California as a result is a real absence of critical access to health care, that including in some places no hospital at all, public or private. And that's really exacerbated a crisis of access to health care. Public hospitals in California are only 6% of the hospitals in the state, but provide more than 50% of the trauma and burn centers and train more than 50% of the doctors. And I return to those stats because what's ended up happening for healthcare in the state of California for all Californians is that the public systems have ended up supporting being the backbone for the private systems across the state. But unlike those private systems, we have far less ability to cost shift to commercial health insurers. We do have that as a part of our book of business. 13% of our health system's revenue is from commercial insurance, and we're going to push on all those levers for sure. But unlike other systems where they can make up for that lost revenue on the private side, we don't have that available in the same way. The other thing that I would say about these public systems is that they have sometimes different shapes and focus. And one of the things that we have done here in this community, and it's been generational investment, is a system that provides the types of services, the level of service, quality of service, and access for all residents in a way that does look different in some other parts of the state. So, in Los Angeles County, for example, the county system serves about 10% of the Medi-Cal population of the whole county. It's obviously a very big county, largest county in the United States. But here in Santa Clara County, we've had to really step in where the private sector has retreated. And people sometimes forget, in 2019, there were no bidders. There were no other bidders, period, in the open bankruptcy auction for those two hospitals.
For O'Connor and St. Louis.
Yes.
Yep.
And
If I may add, sorry.
Oh, and likewise, there was no one stepping up with the reduction in services at regional. And so there wasn't a private market alternative. The alternative was what we've seen in some other parts of the state, which is the total absence
That's
altogether.
really the specific piece that I was thinking about, is in counties that do not, and maybe let's put the rurals aside for a moment because I know the resource level is very different, but in larger urban and suburban counties, if they don't have a public hospital, they provide health care for the indigent through Medicaid reimbursements to private hospitals.
That's right. So all counties do have an obligation for care, indigent care for the uninsured, et cetera. And those counties that don't directly operate a public hospital do have to make provision, and there's a couple different structures, but they do have to provide for reimbursement for that care. It is a general fund cost. I'll add to that that when people look at the general fund investments in our system, not only is there that underlying mandatory obligation that we have as a county, period, but we also have folded our custody health into the health system. That's a general fund obligation every county has as well, whether it's done through a private contractor or through a public system. And so those really, in fairness, would have to be thought of and backed out when you look at what we've done, what investment we have here in our health and hospital system. Every county, all 58 counties, have that statutory obligation. It dates back to the 1930s.
Thank you. My last question is just a check-in on a bill status as well, not having to do with HR1, but SB 16, Blake Spears' bill that did some drastic things around responsibility for addressing homelessness and interference with county budgets, I understand was really gutted, again, with under CSAC leadership as well as our county. Now I'm hearing that it might be back again. Is this a 2-year bill, or do we still need to work on this?
It's a 2-year bill through the chair. SB 16 is now a 2-year bill, and it had been gutted, and then it was gutted again to include a lot of problematic things for us. And so we're going to keep working on that.
So the fight's not over on that bill?
It's not over.
Okay.
Correct.
All right. David, Elaine, Emma, the whole IGR team, thank you. Your job keeps getting bigger and bigger, and that trend will continue for the foreseeable future. So thank you all for everything you do.
David, I think you were trying to provide a comment earlier.
Sure. I just wanted to add a couple of points to what the county executive indicated, and to build on sort of his point about the fact that we actually work with LA County and Alameda County, and actually our delegation and the LA delegation to do a special briefing to key members of the legislature on public hospitals. The reason we did that, and the reason we're going to continue those efforts, is that we do believe, in talking to many members of the legislature, and you have to understand that many of these members are new, and they're new to this role, that there is a lack of understanding of the public hospital system, of what the system looks like, of what it does for the state. And I think that the focus in terms of the hospital system in Sacramento was on the administration, and that there were reasons for that, but I think that a lot of members of the legislature don't know a lot about the public hospital system, and so we are working in partnership with all of the different players, including the 13 counties that run public hospitals, to educate members of the public, members of the legislature on that. And to make sure that as the state is looking at options for dealing with the federal cuts, that there is a specific focus on the public hospitals, that something is done to deal with those concerns. And then the second thing is making sure that we educate them about our system. I think that many members don't understand the extent to which Santa Clara County provides healthcare to its residents, and not just its residents, but to the entire region. The fact that we run the second largest public hospital system in the state, and I think that educating them on both pieces, the public hospital system and our own system, will be key as we push the state to respond appropriately to the federal cuts, and to make sure that our needs as a public hospital are addressed.
Thank you, David. Thank you for the presentation today and for all of your hard work and IGR. I echo Vice Chair's sentiments that you have a full plate and it's going to keep on getting bigger. And I add just one more piece to it is that I'd like to learn more about SB 81, which aims to extend ICE non-collaboration to healthcare and restrict access to ICE without a valid judicial warrant or court order. I'd like to request an off-agenda report and our position if we have one on this particular bill. Yeah, thank you. Oh, and thank you for joining the board. Thank you, James, as well, for joining us at our HR1 convening on Saturday. We had a lot of great feedback from our community members asking for more sessions in the future. So we'll try to manage that, but just please, I extend my appreciation and gratitude for your work there. With that, I look for a motion to receive report.
So moved.
Second.
And we have no requests to speak. Vice Chairperson Ellenberg.
Yes.
And Chairperson Young.
Yes.
Motion carries.
All right, folks, the remaining items on our agenda has been accepted on consent. We're going to be back here again on Tuesday, September 9th, 2025 at 2 p.m. In these same board chambers. And I also just want to remind everybody that for the month of October, we'll have 2 FGOC meetings, including a special FGOC meeting on Thursday, October 16th, 2025 at 2 p.m. in these board chambers, specifically to receive a report from departments reporting to this committee and presenting on the impacts of HR1 on their operations and policies, if any. So with that, I adjourn this meeting.